How do bladder sphincters coordinate urination? Imagine your bladder as a balloon that fills with urine, and your body has a smart system to control when and how you empty it. The key players in this process are two muscles called sphincters that work together with your nervous system to keep things in balance. The internal urinary sphincter is a smooth muscle that surrounds the bladder outlet. It is involuntary, meaning it works automatically without you thinking about it. When your bladder fills, the sympathetic nerves activate and cause this sphincter to tighten, sealing the bladder and preventing leaks. This is part of your body's way of keeping urine stored safely. Just below the internal sphincter is the external urinary sphincter, a striated muscle that you can control consciously. It is controlled by the pudendal nerve, which originates from the sacral spinal cord segments S2 to S4. During times when you are not ready to urinate, this external sphincter stays contracted, helping you stay continent. When you decide it is time to go, your brain sends signals to relax this muscle, allowing urine to flow. The process of holding urine involves a guarding reflex. This reflex increases the tone of both sphincters, making sure the pressure in the urethra stays higher than the bladder pressure. This keeps urine from leaking out. During storage, the sympathetic nerves keep the internal sphincter contracted, and the external sphincter remains tight thanks to voluntary control. When it is appropriate to urinate, your brain's higher centers, like the prefrontal cortex, reduce their inhibitory signals. They activate the pontine micturition center in the brainstem, which acts as the command center for urination. The pontine micturition center sends signals that do three things at once. It stops the sympathetic nerves, causing the internal sphincter to relax. It stops the somatic nerves controlling the external sphincter, allowing it to relax voluntarily. And it activates the parasympathetic nerves from S2 to S4, which tell the bladder muscles, called the detrusor, to contract. As the bladder contracts and the sphincters relax together, urine flows out smoothly. The pontine micturition center ensures this coordination by sending simultaneous signals to the bladder and sphincters, making sure they work in harmony. This precise control prevents issues like bladder sphincter dyssynergia, where the muscles contract at the wrong times, leading to urinary retention or incontinence. Understanding how these muscles and nerves work together is especially important for bladder health and bladder cancer care. If nerve pathways or sphincter muscles are damaged, it can cause urinary problems that affect quality of life. Treatments like surgery or radiation may impact nerve function, so maintaining healthy neural and muscular control is vital for continence and proper bladder emptying. In summary, bladder sphincters coordinate urination through a complex system of involuntary and voluntary muscles controlled by nerves from the autonomic and somatic nervous systems. The brainstem's pontine micturition center acts as the master switch, ensuring that the bladder contracts and the sphincters relax at the right time. This coordination is essential for storing urine safely and releasing it when appropriate, supporting overall bladder health. Always remember to consult healthcare professionals for personalized advice on bladder function or concerns.